post-traumatic stress disorder is a disease that's been around since the beginning of time. I mean, it was first diagnosed back in Sparta. It's been around since World War II, World War I, Korea, Vietnam, and now with Iraq and Afghanistan.
It's that switch inside of our body that tells you to either fight or run. But the problem with PTSD is that it's not a switch. It doesn't turn off. So when we're in combat, such as myself, when we're faced with these scenarios that we're not used to, being on the home front, being safe, then we have to react. We have a startle response. So we react. Now, are we going to fight or are we going to run? And that's part of being a soldier, is knowing when to fight, when to run, and make these decisions. Now that we come home, it's not a light switch. It doesn't turn off. Now we still continue with these same symptoms.
It's characterized by individuals reliving the traumatic event, trying to avoid any type of situation that reminds them of the traumatic event, and then having symptoms of hyperarousal where they have a startle response, they're always on edge, they have panic attacks.
Coming back from overseas, the hard part to getting back and acclimating yourself back into the public arena, as you would say, is I was always hyper-vigilant. I had nothing in common with my friends anymore.
When I came home, I went into a house out in Rocky Point on the island with 4 other veterans, 2 Marines, 2 Army guys. Back to college. My family thought I did LSD. I had changed so much, so dramatically.
Many of the combat veterans, when they come in home, have to deal with issues, not only with what they dealt with in combat, but with family dynamics. And that's a big factor in a veteran healing.
Well, when I came back from Iraq, I decided to leave the military, and I think I kind of had a similar experience a lot of veterans have. It's sort of 2 challenges. There's just the reintegration challenge of kind of learning to become a civilian again. But then I also was struggling with what I didn't realize at the time was post-operational stress.
During a PTSD event, 4th of July is a perfect example. A lot of fireworks going off. It reminds people of the sounds of battle. They relive the event. IED explosions in Iraq and Afghanistan. They want to avoid situations. They're traveling down the road. They're going under an overpass. The hyperarousals there, the sense of awareness, trying to avoid the overpass. Is there going to be a bomb? Is there going to be something under it? The chemicals that are dumped into your body for the panic attack.
And I had a high startle response, so any unexpected noises resulted in a really bone-rattling and sickening kind of reaction. I had different mood swings. I did have a lot of intrusive thoughts that, and memories about things that had happened to me when I was over there that just really were interfering with my reintegration home and my wellness.
I used to have horrible nightmares at night of all these visions of killing people, and I called it sleeping with the devil, living on the dark side. But once I got sober, that stopped.
It was really 3 years after I came back before I even recognized that I was suffering from having served in Iraq. And I even asked myself that question, like, wow, maybe I'm hurting right now because of Iraq.
One of the problems when we come home from combat, men are not born not to see the horror and damage that we inflict in war. And it changes us so much. We give our family PTSD, especially our wife and children.
The Babylon Vet Center deals with war trauma, and we deal with issues of readjustment, as well as military sexual trauma, bereavement. We have couples counseling, we have partners group, we do individual therapy, and we also have group therapy as well.
The Veterans Health Alliance of Long Island is a collaborative effort of about 80 different organizations, including the VA here at Northport, county and state mental health departments, drug and alcohol providers, mental health providers, as well as local universities. And our mission is to promote the health and well-being of Long Island veterans and their families through advocacy and a broad array of services.
Soldiers find out about the Babylon Vet Center through numerous outreach events that we attend in the community, as well as referrals from the VA and other organizations that assist veterans, such as the Soldiers Project and other community organizations.
The Soldiers Project is an organization. It's a group of volunteer social workers, doctors, psychotherapists, family counselors that provide free, confidential psychological counseling for the vets who are returning from Iraq and Afghanistan and their families.
The treatment protocol that we use here at the VA is real evidence-based treatment. We do a lot of prolonged exposure, which is kind of reliving the event, doing relaxation techniques to help deal with the feelings that come up. There's cognitive processing therapy that we use. We use a lot of yoga, guided imagery. Yoga has become a evidence-based treatment for PTSD. There's a lot of group therapy, individual therapy. We try to utilize medications to help with the nightmares, utilize medication to help with panic attacks, depression, anxiety. Along with post-traumatic stress disorder comes a lot of substance abuse, dealing with those issues. All of that's involved in treating a veteran here.
One of the reasons that the Babylon Vet Center and all vet centers throughout the country are so effective is because 60% of the staff are veterans themselves.
People coming from overseas now have to understand that everybody is here to help you. The doctors and the staff at the PTSD clinic truly understand PTSD, and they go out of their way to give us coping skills to help our family and loved ones.
When I came back, I had done a couple of different jobs, but I was just really passionately thinking about those that were still serving in Iraq and Afghanistan at that time, and those that were coming home and struggling. I ended up getting a job with a veterans organization, the Iraq and Afghanistan Veterans of America, and they had me sit down and start reading about PTSD. And I remember going through sort of a PTSD checklist, and that was when I started to see some of the symptoms that I was suffering from. And it was actually a huge relief to realize that there were symptoms and that maybe I really was suffering from something, and it wasn't just sort of my own discomfort or dissatisfaction with life after the military.
When a veteran attends therapy, the first step is often that's the biggest step, is acknowledgement that there is an issue, that there is a problem, and that's a big step.
I had actually decided to talk to a therapist. I decided to talk to a social worker. It seemed less scary to me than some of the other clinicians that are out there. But that was really where I began the journey towards healing. It was 3 years after I got back. I wish I had done it a little bit earlier.
Well, by going through the PTSD residential program, which is a 90-day program, they have given me tools. Unfortunately, post-traumatic stress disorder is a disease. That disease will never go away. But they've given me tools to understand when I become depressed, when I become rageful, when I become judgmental, when I become suicidal, that I can call up people, that I can go to staff members and speak to them. There is a way out of this. There is a way.